Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Oh, I got to plug my computer in. And then also talk about diet in terms of uh, eating plant-based foods, and also the fact that stopping smoking, losing weight, managing your blood pressure, your blood sugar, and your cholesterol. And then in addition to those things that we talk about as well, social isolation and loneliness linked to cognitive decline and dementia. So we have to stay socially engaged. And finally, another thing that we talk about all the time is getting a hearing aid and getting your vision checked. And so and the hearing aid, as we've mentioned many times, contributes greatly to dementia and vision loss also. So those are things you have to keep in mind. One thing that you didn't mention that we usually talk about, and Tatum always talks about it, is the mental games that we use to keep thinking processes straight. But other than that, these are all of the things that we talk about every Thursday. Any comments on how to keep your memory sharp as you age?
Dr. Callender, before we get to those questions, there's something in the chat that I would like to read. Is that okay?
Yeah.
Okay. If you're able, Dr. Callender, to take a look at the chat. It
I
said,
saw it already.
You did? Okay. All right.
Yeah, I saw it. Thank you. Okay.
All right. Thank you.
Any other comments about this article and how to keep your memory sharp as you age?
I think there's one thing they left out, and that's music, playing music. I think that really helps, keep uh, your consciousness and your awareness and your sharpness as you age, because they did not mention the music.
Yeah, they didn't mention that. They didn't also mention the fact that spirituality and the ability to actually meditate. Those are the two M's, music and meditation. Yeah. Any other comments or ideas? Okay, well, I guess we can start the articles. Oh yeah, this is a subject that we tend not to discuss too much. You probably see an article about dental health, probably maybe once or twice a year, maybe if we're fortunate. And for the most part, we don't talk much about our teeth and how to preserve them. And so we thought we would share the comments that we share with our church this month. And it starts out by talking about what it means when your teeth are dark and what you should do to recognize that it's a problem and do something about it. And Uh, the enamel is what protects your teeth for the most part. And so a darkened tooth may mean that your enamel is not working. And so you're likely to get cavities. And then condition called xerostomia, or dry mouth, with a decrease in saliva production that is harmful and can lead to inflamed gums and cavities and other things. Then, of course, the caries, which we have as a real problem that causes gum recession, and this is something that all of us have been exposed to from young ages up until old ages, and many people lose their teeth as a consequence. Then gum disease periodontitis because of food left in the mouth, tobacco products, and poor fitting bridges and dentures, and diets, and gum disease can all lead to tooth loss, which is very common in people who are over the age of 60. Then, of course, sore mouth because of poor fitting dentures. And I think poor fitting dentures is becoming a big problem as you age. Getting the right fit is not so easy. And then, of course, fungus infection can be a problem. Then, of course, if you have rheumatoid arthritis or osteoarthritis, and you can't use your hands and your fingers, it's difficult to brush your teeth, as you see here. I think you should brush your teeth at least twice a day with a fluoride containing toothpaste, and I think you should floss it twice a day as well, but at least once a day, and rinse with an antiseptic mouthwash, although many of the articles are talking about extensive washing can wash away the fluoride. But anyway, it's something to do. And then visit your dentist probably at least once a year. Now, you talk about the diet being important because vitamin C is essential. Calcium is important as well, and leafy greens like spinach and kale containing a lot of vitamin A. And then foods high in vitamin C like citrus fruits, strawberries, and bell peppers support healthy gums. And then phosphorus contained in fish, lean meat, and eggs help protect the tooth enamel. They are also high in vitamin D, which is helpful for many reasons. Then this is something that we tend not to emphasize. Crunchy fruits and vegetables like apples, carrots, and celery help clean your teeth by acting like a toothbrush. Drinking plenty of water helps everything, including the teeth. And then green and black teas contain polyphenols, which slow the growth of bacteria and cause bacteria which cause cavities and gum disease. And then finally, to support good oral health, alcoholic beverages and beverages highly in sugar or caffeine, such as juices, sodas, sweetened teas, or coffee, sugary drinks, feed the bacteria and erode the enamel. Tomatoes and citrus fruits can also do that. But it's important to remember that dental health, like physical and mental and spiritual health, are all necessary to achieve and maintain good health. Darryl.
Yeah, just wanted to emphasize a significant effect that alcohol has on dental health because it increases acidity, which erodes tooth enamel, makes it more susceptible to cavities. It promotes plaque formation, uh, dehydrates the body, that reduces saliva production, and saliva helps wash away bacteria and protect teeth from damage. And heavy consumption is a risk factor for oral cancer. So, it's in the same category we talk about. Smoking is something we should absolutely eliminate, and alcohol is pretty close to the same thing.
Thank you for sharing, Darryl. Any other comments?
Dr. Callender, I just have a question. Do it, I I've heard before, and I don't know if it's true, trying to save a few teeth is better to take out all your teeth, or do dentists, they try to save a tooth or two, or it's better for you just to lose all your teeth if you have gum disease or you want dentures or something like that. Do they try to save a tooth, or it's better just to get them all extracted?
I think you just save as many teeth as you can.
Oh, okay. Because I remember my mother was going through, and I was thinking maybe it was the same thing like what they used to do for women in hysterectomy. If they had any type of problem, they would just say have a hysterectomy. And now they're trying to say they don't have as many as they used to. And I was thinking the same thing about teeth. One or two teeth gone bad, just extract them all and put in dentures.
Uh, most dentists try to keep your teeth if possible, and then when you lose a significant amount of your teeth, and then you may need dentures. But if you have teeth that are healthy, it's good to keep them. Any other comments or questions?
I heard last week that one of our presidents, when he passed away, he only had two teeth left.
Yeah, well, most of the people who are over 70 have few of their teeth. It's something that occurs as a consequence of not caring about your teeth at younger ages. And so you find that much time is spent in the older ages in the dentist office, not just once a year, but as often as necessary to keep teeth. Then there are some conditions. I have a condition that my dad told me about, that where you have a bone elevation in the upper part and lower part of your mouth, which makes fitting dentures extremely difficult. So therefore, it's important when you have those kind of conditions to save as many teeth as you can and avoid needing dentures if possible. Okay, any other comments or questions? If not, we'll move to the next
Oh,
article.
just one more. Are implants, I know they keep saying, do implants, are they really good for you?
Yeah, I think they're wonderful, but they're so expensive, very expensive. I think somebody in the last meeting said they have a car in their mouth because that's how much it costs, same as much as a car. And so you have to make a decision whether you want to get implants, which are very good. I mean, they look good, and you think they're real teeth, and so, but they're very expensive. Yes. Any other comments about because most people don't smile as much anymore when they get older because they don't have teeth, and so they don't feel comfortable smiling, and so try to do what you can to preserve your teeth as long as you can.
Yeah, the other thing about grunchy old men is that the doctors tell you to chew your food good. Well, if your teeth aren't strong and healthy, you have a hard time chewing your food well. And then that will reflect in your digestion.
So true, so true, so true. Thanks for sharing.
And
Dr. Perez?
some of the we've learned, especially in pediatrics, that it's very important to make sure that our children have good oral health because it can impact other chronic illnesses. And the fact that we are having so many major cuts in child health care and these preventative opportunities, that we must rise up because we know better.
Okay, Betty Blaylock, are you still having difficulty speaking to us? I guess if we can't hear you.
Oh, you can't hear me?
No, not you, Betty Blaylock.
Oh,
she had in the chat, she'd indicated that she was trying to talk, but we couldn't hear her. So I was trying to ask if I could see her, but couldn't hear her. So I guess she's
Well,
still wrestling with that
she
problem.
got to turn the volume all the way up on all her devices.
Okay, let's go to the next article. And uh, Elizabeth, you had a comment?
Yes. Good morning again, everyone. My retired internal medicine doctor always said that when I went to the dentist, for any reason, to make sure that they double checked my teeth because of the medication of high blood pressure that I was on. So that has helped me a great deal.
Thank you for sharing. Okay. Uh, this is an interesting article that talks about even regard health literacy is thought to be the biggest problem in terms of why people who stay on dialysis do not get transplanted, because they don't understand the fact that the likelihood of dying on dialysis is so much greater than it is after you have a transplant. And so some said that the biggest problem was health literacy. And this article is saying that regardless of health literacy, if you actually give them the information, that it would improve the amount of people who would uh, know what's going on with kidney disease and know about the option of transplantation. And so this study was done to find out whether it made a difference, regardless of whether the people understood 100% or not, whether it made a difference. And it appears that if they're given the handouts and then they ask them to read them, that they actually can comprehend and make appropriate decisions. For many instances, the information was not shared. They just asked you, do you want to transplant and move on? And so this article is refuting that and saying, hey, give them the information and let them read it, whether they have a college education, a high school education, or whatever. Let them read it and give them an opportunity to make a decision, an informed decision, which often does not occur. And I think it's a very important article because uh, sometimes in some centers, the option of dialysis transplantation is not given a good share of the correct information. And so people will then not get transplanted, which is a problem. Dr. Press.
I think there were several testimonies at your 50th about this support group. And I may, well over a decade, maybe two ago, I remember being in a support group over at Howard, and that information had not been shared. And I believe that that week at least, this young man had received a transplant. So everything that this transplant support group is about is getting the word out. And for 50 years, not only in the literature, but by word of mouth, you've been doing this.
Yeah, it is amazing. It's important to recognize that getting the message out to all levels, to people who have the disease and their relatives and friends, makes a big difference. They can be much more supportive as members of this group have attested to in the past. Any other comments? If not, we'll move to the next article.
So this is actually saying that reading is better than a personal testimony or etc.
No, it's not saying that. It's saying that it is, even though the people are not do not have high school and college educations, that you can give them the literature and they can read it and they can still understand it. Because some people have said, well, because they don't have high health literacy, you don't need that. Giving them the information doesn't help. But this is just saying that giving them the information does help. Any way you can get the information to them by word of mouth or by information, but some people felt that because of poor health literacy, that giving them the information was not helpful. But this article is saying, yes, it is helpful. Not saying it's better or worse, it's just saying that it is helpful. Okay, there are no more comments. Let's go to the next article. Well, with the new administration cutting out programs, funding few programs, this is an article that advocates to reinstate diabetes prevention program. The funding of most programs is being cut out, as being eliminated, and this is an effort to get them to go back to doing things the right way. As you know, this is from Columbia University, which lost up to $400 million in funding. So you can understand that this funding is so critical to preventing disease. An ounce of prevention is worth a pound of cure. And so this article is doing what many of us are going to have to do, and in spite of which funding is going to be taken away from many programs. And although the new leader of health education welfare is a proponent of prevention, he, however, is not doing anything to stop but as a matter of fact, is increasing the number of grants that are withdrawn, which is sad because prevention, of course, is where most of our efforts are supposed to be. And that's where he has alleged that he was going to spend most of his effort. And this may well come to pass, but the early evidence is not demonstrating that. Any comments? This is something that we're going to see hundredfold increases in this. He's talking about decreasing the education budget. And of course, we know that's going to directly affect the Black males who already are low in number. But it's going to affect the Black males more than Black females, because the Black females have been rising to the occasion regardless of the obstacles, whereas the Black males have diminished to almost be non-existent. So if ever there was an effort to be trying to destroy the Black male gene, this is another one, and a real powerful one. Any other thoughts, comments about this? And this is just the tip of the iceberg.
I just kind of wonder what what are they going to do with the money that they are cutting off from these services, and where is the improvement of diminishing services like that, like this, or any preventive service, or medication or education? I'm wondering what is going to be the end game of all of this. What do they want people to do?
One of the end games is that Black males are going to suffer more than any other ethnic group. The other thing is that, yeah, a lot of the funds, they're talking about trying to raise trillions of dollars for the United States to balance the budget. And so that's what it's all about. The price we're paying for that, however, is significant for people of color. But that's the goal. The goal is to save trillions of dollars. And
I
the
see.
initiative that they are working towards is going to save millions of dollars on the backs of uh, people like us. Dr. Perez?
You have to include the fact that this is a significant tax break for billionaires. So not only are you crushing us, you're giving to the wealthy. And it's dictatorship.
Well, we asked for it. I mean, we voted him in. So, yeah, you're right. Everything you say is accurate, except that we voted him in. If we didn't vote him in, you could say it's a dictatorship, which it is. But we voted him in. We authorized him to do this. So, Janice, you,
Yes, I don't know how true it is. I heard, and this to me sounds like something that they're going to do just to save face, that they're initially going to give out stimulus checks um, to everyone. How it's going to be distributed, I don't know. Maybe the same basis of when they did stimulus checks during COVID. But everyone is asking of, I know of several people anyway, asking, where's the money going? They're cutting out a lot of programs and millions of dollars, and what's happening to it. So that's something that I heard, that they're going to give out stimulus checks. In what
I believe it
quantity,
when I
I
see.
don't know.
I believe it when I see it. But
Yes.
it's clear it's going to be trillions of dollars that
Yeah.
that they're saving. And the
Mhm.
question is, who is it going to go to? And
Right.
it's clear it's going to go to the United States government. But how it's going to trickle down to the level of people of color is another question. John Buchanan?
Actually agree with getting rid of the debt. I mean, we're trillions of dollars in debt. It's just the method of doing it seems to be kind of helter skelter and also skewed toward the wealthy, like you just said. I I wonder how we can exist borrowing money from our political enemies, especially China. Uh, how can we exist like that? And uh, so, on one hand, the way it's being done, I hate a lot, especially in the areas that affect uh, us as Black people. Um, but I wish that we could be out of debt and be solvent uh, financially and fiscally. Thanks.
Any other comments to share? If not, thank you for those. And let's go to the next article. This is a common complaint nowadays is that we are not giving obesity its due. That we, of all the diseases that are identified as chronic inflammatory diseases, obesity is one that doesn't get that clinical classification. And yes, it is a chronic inflammatory disease. And it is, of course, in some instances, lack of self-control, poor eating habits, and a sedentary lifestyle. And in some instances, it's basal metabolism rate issue, and a combination of all of those. But to
Poverty.
actually accept this as a disease entity, uh, and not be the butt of jokes and stigmata, is something that we're working to overcome, so that people, and all of the studies we've done and others have done, have demonstrated that obesity is a chronic inflammatory disease. And the question is, why is it not treated as such? And this article is trying to get us to do more of that, recognizing this as a disease entity that needs a special category of understanding and be treated as a chronic disease, which it is not in the classification of chronic diseases, and it should be. Any comments on this? Because this is something that these authors are concerned about. Carol Tatum?
I think maybe is it race related? Because it might not be, but until it's just like the drugs, until it affects them personally and their race, do they start doing studies and give out warning signs? But right now they don't care because it's not prevalent in their race.
Well, it's prevalent everywhere. It's
Oh,
just
okay.
more prevalent in our population. About 50% of Americans are overweight. So,
So do you know what the percentages is according to blacks?
yeah, it's over 50%.
Over
If
50% for
you if you're
blacks.
above the age of 40, it's above 50%.
What about whites?
It's in the 40% rate.
Okay.
So it's not that it's not common in both ethnic groups. It's just more common in our ethnic group. Dr. Perez and then Darryl Armistead.
And I think it's like the previous article that talked about level of education and ability to understand what's going on. I do remember when we talked about a little sugar and a little sugar for us, just like, chubby and other things. And you can't not include poverty when you talk about obesity in children and
The
food
poorest people in
deserts.
America are white also.
Excuse me?
The poorest people in America are white.
Absolutely. And you can see it. You can see the obesity there. I, went to an upscale graduation, and what amazed me, this was a graduation for middle schoolers.
Wow.
And there wasn't an obese or overweight child in the group.
Really?
That's what shocked me.
Yeah, that's wonderful. That's
And
good to
that's
see.
where our tax dollars are going, to them, to their parents, to the 1%. We
Okay.
know the information and we're going in the wrong direction.
Okay. Darryl, you had comments?
Yeah, obesity rates. For non-Hispanic black adults, 49.6%. That's African American adults. Hispanic adults, 44.8%. Non-Hispanic white adults, 42%. Non-Hispanic Asian adults, 17%. And how that compares to European obesity rate, overall for Europe, obesity rate is 23%.
That says it all, doesn't it? Yeah. Yeah. And it's interesting, the Asians who increase that are those who have come over to the United States and eaten the American diet to get up to the 17%. So thank you for sharing, Darryl and Lucy. Any other comments?
I think it's a mindset also, which starts, like Dr. Perez says, in childhood. Um, the focus on sweets and treats and things like that.
Mhm.
That's also backed up by the media, especially. Watch television, watch kids' TV, watch any TV. There's so many articles about food and chicken and
Any other comments? If not,
Just one, I'm speaking on behalf of John. When he went over to Asia, China, and he said they recognize Americans by their size. They could tell right away because the large people were the Americans. It wasn't so much color. I think that's what John was saying when he went over there. They just say you are an American just by our size because we're fatter.
well, we're also taller.
Oh, okay.
We're also taller. Right. Yeah.
We also call it round eyes.
Yeah. Okay, let's go to the next article. Oh, where's this next article? Oh, yes, midlife life diet quality is linked to brain changes in later life. So what they're saying is that when you're age of 40 to 70, that's when it's important to eat the right food so that your brain will not waste away. So that when you get to be 70, 60, and 70, your brain is already half destroyed. And they're suggesting if we had healthy eating habits, more plant-based diets, uh, we would be better. They also emphasize the waist to hip ratio. Remember, we talked about the fact that a big butt is healthier than a big belly. And so the waist to hip ratio, along with the diet, are two factors that play a significant role in cerebral dysfunction as you age. And they talk about the places in the brain, the hippocampus, and other locations in the brain, which may be part of the issue. And they call midlife 50 to 70. So for those of you who are in that category, can say you're middle aged. And those of us over 70 are old. Any other comments about this article, which is not a surprise to us, but something to read about and appreciate?
Darryl's birthday was Monday. He's over 70.
He's now older. Okay.
He's over 70.
Well over 70, 76.
76
Three score and
trombones.
six.
Yeah,
Three
76
score.
trombones. That's a piece that John Philip Sousa wrote. Okay.
Okay. The next article talks about peanut oil immunotherapy falls or fails when you miss doses. Well, I guess if you miss the treatment for it, I guess you are going to fail. And so this looks at the desensitization effort and the remission effort. And it talks about that peanut allergies are serious, as we know many people have died because of peanut allergies. And the desensitization process does take time. But if you miss the doses that you're supposed to take, then the treatment fails. No surprise. But anyway, this is a double-blind, randomized, placebo-controlled trial. And I don't know if how many of you have any peanut allergy children in your family, but this can be significant to know. So they have to really follow up with the oral immunotherapy. And if they don't follow up, then the immunization is not going to be successful. Okay, I don't know many of us have family who are have peanut allergies.
I do.
But I say that because there have been so many fatal cases of people who have peanut allergies.
I was wondering, Dr. Callender, how does that actually work? They give these children small doses of peanuts and try to desensitize them.
Yeah, yes, that's the process of desensitization, and in virtually in most desensitizations, that's what happens. They give you small amounts of and they try to build up your ability to not have an allergic reaction to this substance.
If you've ever experienced one, it's worth it.
Yeah, because it's fatal. Those
Yeah.
reactions are fatal.
And it can go quick.
Yeah, yeah. Within an hour, you're likely dead. Yeah, if you're not treated. You don't go to the emergency room and get treated. Darryl?
Yeah, I was just looking at some causes of peanut allergies. Oh,
Janice
Janice was
going,
getting a
you go
call.
mute. Okay, go ahead, Darryl.
Yeah. It says children with eczema or egg allergies have a higher risk of developing peanut allergies, and hygiene. That improved hygiene can reduce exposure to certain germs and infections, leading to a less robust immune system and increased allergy risks and vitamin D deficiency. So, okay, when I look at my childhood, uh, we were outdoors getting plenty of sun in the dirt. Never did eat one, but there was talk about eating mud pies. We weren't so clean. We were drinking out of water hoses, and the eczema thing. Maybe that's sitting inside eating a whole lot of chocolate, watching TV. But we weren't inside watching TV. We only had three channels, and two of them didn't work half the time with the hanger antenna on the TV. So, being outside, being dirty, getting exposed to sun, that may have been very helpful and protective against peanut allergies.
Yeah, yeah. Thanks for sharing. Any other comments? Let's go to the next article. This is the first new antibiotic for urinary tract infection in 30 years. And so they highlighted it's a very new antibiotic with a new name, uh, as you see here, gepotidacin and lupa. Actually, to me, when I read this article, it's probably as good as furidantin, which is a drug that has been used for many decades and is not associated with a whole lot of sensitization. But this is, anyway, a drug that is comparable to furidantin, but is new and doesn't cause the development of resistant organisms, which some of the other antibiotics do. So if you get a urinary tract infection, uh, using some of the modern antibiotics is not the better way. It's the furidantin or this one that would help you treat the urinary tract infection and not develop resistant bacteria, which is a problem. Next slide.
Well,
Dr. Callender,
Yes,
this is Sylvia. Good morning, everybody. What about the old antidote of drink a lot of cranberry juice?
cranberry
Or
juice is good. That's a good remedy, and it's recommended by all urologists. But if this is in case you get a urinary tract infection, this is how you would treat it. The cranberry juice is going to help prevent urinary tract infection.
So, I had a question, Doc. Of course, you already know what my question is. How expensive is it going to be, and will it be available?
Well, Furidantin is cheap and it is available. So uh, when it comes out, I don't have any idea. They don't say anything about the cost. So, but Furidantin is very cheap. So that's the antibiotic that uh, is preferable until this comes out and we see how expensive it is. The more fancy antibiotics are more likely to cause the development of resistant bacteria, whereas Furidantin is a drug that is not used by too many, but is very good for treating urinary tract infection, and it's not one of the fancy new drugs. Dr. Perez?
Some of our tariffs on China are going to impact our generic drugs. So we might even find that many of them, since big pharma in this country moves away from generic drugs and maintains trademarks, um, we might see a significant increase in our longtime generic friends.
What does that mean to the community? Could you tell us what you said and what that would mean to the community?
Well, many of the generic drugs. So after I think it's about 14, 15 years, the company that made the drug now releases its formula so that it can be made by other entities with the same formulation. And that significantly reduces the cost of the drug because there's competition. One of the places that we get a lot of our generic drugs from is China, and I believe also India. And with the global tariffs that the president is putting on things that come into this country, it will significantly increase the price of drugs at the time that we're removing Medicaid as an insurance policy for people who are poor.
Okay, thanks for sharing. Any other comments or questions? Okay, let's move on to the next article, please. This is kind of something we talked about last week, I think, the fact that non-fatal fentanyl exposures are increasing substantially. And this is frightening. The fact that they're non-fatal is wonderful, but the fact is that this may not always be the case. And fortunately, we now have available drugs that reverse the effects of the drugs, but this may not always be the case. So we are fearful that with so many adolescents being exposed to fentanyl, that in the long run, we will see an increase in the fatal numbers of exposures.
Again, we know this and we're going in the opposite direction. All the programs, lads, all the programs that will address this have been slashed or completely eliminated.
So true. Darryl, any comment?
Yeah. There's a fentanyl exposure rates by race in the United States, and this is for overdoses. 79% of overdoses are non Hispanic white. That's 79%. 10% are black and non Hispanic, and 8% are Hispanic. So you can see this fentanyl is primarily the drug of choice for white people.
Hearing. Dr. Perez?
Now, right now it is. But that can change. And if you look at the numbers, especially for adolescents, I mean, we were less than 1% of the suicide rates. And now it's an epidemic in young adolescent boys. Drug use. I mean, all of these things, especially in early and middle adolescence, was not a problem for our community.
Past tense. Past tense, because now it is.
Yes, it is. And that's why I'm saying, even though our rates might be lower as it relates to fentanyl, that is the way it's been.
Any other comments about this potentially lethal drug?
Especially when we just did the article about the attack on education in Black boys.
Yeah, well, you said that already, and you said that this is a category that we need to address. Okay. Any other comments?
Yes, I just I guess I'm hooked on money. But um if we can't afford regular drugs, like the drugs of choice for various diseases, if we can't afford those, how can we afford the fentanyl type drug? I mean, I don't get it. I just don't get it.
Dr. Perez?
One of the ways that an example, like when you say some of the older drugs, if you don't mind, like cocaine, right? Cocaine had been around for decades and decades, right? But then when cocaine was funneled, and the politics and the economics about that will probably be a much longer discussion. To sell it on the street, it became crack cocaine. And a lot of politics associated with incarceration and the selling of the drug made a significant impact on our community. Likewise, fentanyl, it's not the drug and its name, it's the impact and the effect. So the depression or the downer, the sedation that you get from fentanyl will become popular on the street, and so will its availability cut down and changed in form. Just like we did with heroin. All of these are morphine derivatives. And it's not the drug, but the effect of it. Does that make sense?
It does to me.
Okay. So it's not.
Darryl?
Oh, yeah. Let's see, crack use by offenders. 83% of crack cocaine offenders are black, followed by 10% Hispanic, 5.8% white. So, crack is cheap. That's the drug that's marketed to us.
Okay, thank you for sharing. Any other comments or questions? If not, let's go to the next article, please. It's interesting that even with skin disease, medications alone is not enough. Diet also brings benefits. So, the skin disease uh, is interesting that what they're finding is the same thing that you find in everything else, and that medication alone is not enough, and that dietary, what you eat, certainly affects the skin, the largest organ in the body, and this then helps us to emphasize the importance of a plant-based diet. Once again, all of the indications are that a plant-based diet is the diet of choice. And it's not surprising because, in a sense, that the skin is very sensitive to everything that you take into your body. Any comments about the importance of the skin and your diet and the many different skin conditions that actually exist? They talk about psoriasis, which is one of the skin diseases that we have. And any comments? Anybody who has skin diseases? Now, melanoma, of course, is in a different category because it's cancer. But we have medications that treat that and surgical treatment for that as well. So I guess the bottom line is that it sounds like all roads lead to the same direction, and that is that a plant-based diet is the diet that uh, 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 is most associated with uh, better health and less disease. Any comments about that? Which is something that no Thursday goes without us saying this. And they emphasize this high fiber diet, which we've talked about, which is critical. Any comments about this? If not, let's go to the next article, please. Annual lung cancer screening is something that is important to do because it improves cancer detection rate. And nowadays we can treat lung cancer by a number of different variety of treatments. The ability of the low-dose CAT scan has not been effectively publicized as treatment for early diagnosis of cancer, which then can be treated. And lung cancer is still, as you can see here, killing a number of people. And one of the things is that if people become more aware of this and they get these CAT scans, they can make a diagnosis and actually have treatment of cancers at an earlier stage, which then results in saving lives. And so this is just to get more people to get lung screening. And of course, those who have a history of smoking are this is most important for them, more important for them than anybody else. John Buchanan.
Yes, I think you may have answered my question. Why would regular people need to get the screening?
Yeah, anybody who smokes or has
Oh,
a history of smoking.
okay, okay.
Those are the ones who need it more than any other group.
But if you say I've stopped smoking 30 years ago,
If you've ever smoked,
ever smoked, but so I should ask my doctor for a lung cancer screen.
you say you stopped smoking 30 years ago?
Yes.
Um, I think most of the data talks about people who smoked 20 years ago or more, but it's food. You can talk to your doctor about it. He may, because it's been 30 years, he may have another thought, but anybody who's ever smoked, this is a screening process that they should consider.
Thank you.
John Tatum?
Yeah, I had a question about the these X-rays. Are they safe? Are they safe?
This is the low dose CAT scan. Yes, this is safer than the other test, and you're only going to get one a year or something like that. So just one low CAT scan is worth the risk if you're a smoker. Dr. Perez?
My screening for it was that it was how long ago you smoked, but more importantly, how much you smoked during that time that you smoked. So they take the years that you smoked and the amount, and they aggregate it and they give you a percentage. And under Obamacare, if you fall into at a higher risk for lung cancer, then it is a covered Medicare service.
Thank you for sharing. Jacobin?
Yes, sir. Um, my mom died at 92, and she died because of lung cancer. She never smoked, but she did work in textiles. She worked for the old Lane Bryant, and we think that's where it may have started. Um, I'm just well, and at the time that she was on the treatment, after they found the lung cancer, um, Medicare would not pay for the treatment. Uh, so that's been now 18 years ago. But like it's mind blowing that she never smoked, and they put so much emphasis, and I can understand why, on smoking. But that's just my comment.
Well, thank you for sharing. One of the things that we have to recognize is that the point that you made is important, that there are other toxins that can harm the lung as well. And uh, another thing that is to be considered is that some people who don't smoke actually are in environments where there is smoking. And this secondhand smoking impact is a great one. I think of my nurse who didn't smoke at all, but her husband smoked, and she got lung cancer and he didn't. So these are some factors to consider that. And as a matter of fact, my wife's grandfather developed lung cancer, and he didn't smoke either. But his was related to the secondhand smoke. Yeah. Any other comments? Yes, John Buchanan.
And another example, my father's wife um, died of lung cancer, and she never smoked a day in her life. And they say it might have been a result of radon.
Interesting. Yeah. That brings up the concept of getting your house checked for radon, because that is now a noted cancerogenic agent. Dr. Perez, you had another comment?
They're also saying that there's third-hand smoke, which is the residue from tobacco objects in clothing, in households requiring new paint jobs, things of that nature. Third-hand smoke.
Thank you. Thank you for sharing that. Any other comments? If not, we'll go to the next article. This is interesting because it talks about something that's going to affect many of us. And now that COVID is decreased and they're taking away the funding for COVID, uh, many want to maintain the telehealth component. And the question is, will this be affected? As you know, many of the COVID funds are being withdrawn. And the question is, what about the telehealth access for controlled medication? As you know, many of the addicts are on medication, and right now, because of the telehealth component, they can just get a 6-month prescription over telehealth, but this may go away. And this is what they're concerned about. And this is going to be impacting people of color disparately. Darryl?
Sorry I'm late about the lung cancer discussion, but cooking
Okay.
oil fumes can be another cause of lung cancer. And so when you're using cooking oils, it says if you have a properly functioning range hood and you use it, it can potentially lower the risk of lung cancer by as much as 50%. So I don't know if we just automatically think about if we're cooking with cooking oils, make sure you've got the range hood on.
Thank you for sharing, Darryl. Thank you. Okay. Any other comments about this article and the impact of taking away telehealth access for people who are on controlled medications? This may or may not have an effect. It's a huge population that's on buprenorphine, which is they're addicted, so they stay addicted to this drug, which is a painless, peaceful way of ending addiction. And the fact that this will involve a large number of patients is a concern. And so what is happening is they're continue this until December 31st. After December 31st, they may make a ruling to not do it anymore. But this is an effort to get them to maintain this, because it's such a large number of patients who actually are treating their addiction by this drug. Dr. Perez, this is an area of her expertise, by the way.
Buprenorphine was a game changer. I mean, people who did time multiple times got on buprenorphine and changed their life. I mean, we put in a little Jesus there too, but I mean, the difference was so significant. And there are a lot of people who, without the ability to deal with telehealth would have to then be more transparent about their disease, which could influence their family and their livelihood. I am telling you, buprenorphine, game changer. Just like we talk about GLP-1s, that was it for people with morphine derivative addictions.
And there's so many that fall into that category. So that thank you for sharing, Dr. Perez. John Buchanan.
Dr. Perez, is there another name for buprenorphine? Because I'd never heard of it. And drug therapy against addiction is are the people who receive that, or do they get addicted to the buprenorphine?
Yeah.
Yeah. But they no longer have the craving for illegal drugs. And so that's what makes the difference.
Thank you very much for sharing, Lucy, because this is a drug that has changed people from being zombies to being people who are working jobs and living in spite of their addiction.
And
anyway,
keeping them out of the criminal justice system. I mean, major.
Yeah. Thank you for sharing, Lucy. Any other comments or questions? This impacts us to an extraordinary degree. Next article, please. I know this is a very interesting article because when should you consider weight loss meds for obesity? And it's interesting. They say when you have a BMI greater than 27, or you have a condition like type 2 diabetes or hypertension, hyperlipidemia, or sleep apnea, anybody greater than 30. So, and this is something that the category of 25 to 30 is overweight. Category of above 30 is obese. And so many fall into that category of being overweight but not obese. Probably are not going to want to be medicated. Yeah. Because they may decide to do it without pharmacotherapy. And you saw the other article that said that, oh no, we haven't come to it yet, that equates waist to hip ratio as being a better barometer of overweight than BMI. But anyway, this is something that it's important to understand that a big belly is more dangerous than a big butt, and that a big belly may be a good reason to take medication to overcome your obesity. Any comments about this article and when you should seek treatment for being overweight or obese?
A lot of people are using Ozempic for that reason.
A lot of people are using what?
Ozempic.
Oh, you mean, yeah, right. Yeah. The GLP-1 drugs, right. Mhm.
But the other thing too is it seems like most of the weight loss drugs are bad for you.
Well,
Most
it
all the
doesn't,
others.
I wouldn't agree with that. Weight loss drugs have some side effects, but that's true of all drugs. There's no drug except maybe water that doesn't have any side effects. All other drugs have side effects.
Water can be bad too.
Too much water, yeah. But yeah.
With the impurities,
Mm. Any other comments or about this? If not, let's go to the next article, please.
Just one comment.
Yeah.
With that article before, especially with bariatric surgery, there were criteria for use. With GLP-1s, I think so much of it in the category from a BMI of 25 to 30, a lot of people I know who would be considered overweight have chosen to use medication after decades of failed personal strategies for weight loss.
Thank you for sharing. Okay. Good to see Praline again. Welcome, Praline. Good to see you. HB infection may raise risk for cardiovascular disease. We talked about the HPV last week as well, but it's playing a role in the disease playing a role in cardiovascular disease is relatively a new finding. We don't discuss more about HPV being a source of cancer, of cervical, vaginal, and oral cancer. But its impact on coronary disease and cardiovascular disease is something that we have not paid much attention to. So this opens up a new door to make sure that HPV is prevented or eliminated. Any comments about HPV? We've talked about it before, but this may be another reason to talk about it again.
I think it's important for the talk of sexual activity that we tend not to do and the prevention methods that are really important across the board.
Thank you for sharing, Dr. Perez. But I just think that in the past, people talked about HPV as for cancer, but didn't recognize its cardiovascular impact. And so this article is making us aware of that, giving us more reason to get HPV vaccinations. Next article, please. I thought this was very interesting. The American Association of Pediatrics adopts updated policy, and they say that pediatricians must disclose mistakes. Now, it's interesting. Somebody say, why only pediatricians? Why not all physicians? Why shouldn't they all disclose their mistakes? And certainly in surgery, it is recommended that you share your mistakes, but it is not mandatory. And this is interesting that pediatricians must disclose the mistakes. Dr. Praise, any comments on this?
It might have to do with insurance because of the 21-year tail that you have on your insurance policy. So that pediatricians have to be insured for 21 years after they've had any interaction with the child. And so I'm assuming that it has that association.
Were you surprised by
it? Disappointed in being singled out, but it is the practice of the National Medical Association, the institution that has represented Black physicians for close to 130 years. It has been the conscience that moves us. And it's the kind of physician and leader and unselfish man that you are, Dr. Callender.
Well, it's a policy that makes sense. It's just that, as you said, that it singles out the pediatrician is a surprise to me. Carol Tatum?
Yes, I'm taking the adverse side because people, the way they think now, they blame everything on everybody else but themselves. So if a child is in special ed, per se, it's the teacher's fault. If a child is born with a deformity, it's a gynecologist's fault. If a child gets even measles, it's the doctor's fault. They blame everything on, they don't seem to, if you get cancer, it's something that the doctor didn't diagnose. And the way they are protective about children these days, if they act up or anything, it's your fault. What did you do to cause them to throw a chair at you? So when you take this protective agency around doctors, we're sue crazy around here. Everything that happens, you're going to sue them. If you get in an accident, even if it is your fault, you're going to sue them because they didn't make the car right. We have just gone ballistic. So when they take one more barrier from these crazy people out here that want to sue and blame everybody else for their deformities, their faults, or their child didn't come out to be this purity genius, then I just feel sorry for the pediatrics. I feel sorry for everybody, really.
You're on mute, Dr. Callender.
We do. He's a mighty example, let me tell you. I have not gone anywhere in the country. And anybody who's ever gone to Howard School of Medicine who does not have a beloved story to tell about Dr. Clive Callender.
Okay. Thank you. Amazing. Okay, if there are no other comments, we'll go to the next article. Thank you for sharing, Carol. This is an article that I have mixed emotions about because finding clues to the early diagnosis of Alzheimer's would be of great importance if we had treatment for Alzheimer's. But since we don't have treatment for Alzheimer's, finding all of these tests, all of these new non-invasive techniques, infrared spectroscopy, EEGs, to look out for the neurovascular aspect, and finding this as much as 10 to 20 years before, what good is it if you don't have treatment for it? So, and I think the good thing about this is as we get these early tests and wait for the treatment of Alzheimer's that is going to be effective, when it does happen, we will be ready to make a diagnosis. You see here, there's a lot of different opinions about whether amyloid is required for the diagnosis of Alzheimer's or not. In the United States it is, in Europe it isn't. And so when we are of one mind on this and what causes it, and we know how to treat it, then we're better off. But right now, I'm not that clear on the advantage of knowing that you have Alzheimer's early until you have a treatment for it. Any other comments about Alzheimer's and this new diagnosis that picks it up early?
Dr. Callender, it may be this information could help as far as prevention, maybe.
Well, when we have that information, I'd be glad to share it with you, but we don't have it. As you know, we've discussed on many times the ways in which you can minimize the likelihood of developing Alzheimer's, but we don't really know uh, other things other than the steps we've shared here and about ways to develop to prevent Alzheimer's. But this is treatment for early diagnosis of Alzheimer's. And so far, we don't have any effective treatment early Alzheimer's. But I expect that one day we will. And so we can keep doing these things. And then when we have this treatment, we will be able to use it. Right now, it's not helpful to us, but in time, it may well be. Any other thoughts or comments about these efforts with Alzheimer's?
Dr.
Okay.
Callender, I agree with you. My mother developed it, didn't go to a advanced stage or anything, but she was fretting about it, and she had to come from Indiana to live with me. And while she was fretting, I said, well, Mama, there's nothing we can really do about it. And once you have it, you won't remember that you have it. And she thought about that. And I made it as a joke. And she laughed about it. I said, so just worrying about it doesn't do a thing about it and trying to prevent it and all of that. But since we don't know what to do, we know a little bit about maybe what we can do to prevent it. But to talk about and to fret about it, what else can we do? Just be aware of what we eat and drink and how we exercise. But other than that, there's nothing we can do until they have a treatment and really know what starts it, in the first place.
Thank you for sharing, Carol. Lucy, I'm sorry, Dr. Perez.
Lucy is fine. Is it time for us to begin to have those conversations? I have a cousin who is exhibiting significant mental decline, and she's 9 months younger than I am. I'm compassionate about her, and I know it's a sin to worry, but it's a conversation. I'm getting my house in order, yes, but and I'm doing my games and I'm staying engaged. Doing following Darryl's diets and all that. I haven't had so many vegetables in all my life. But it is a conversation for our community to begin to have. And I especially think that it's a charge for the church to be comforting and supporting of people and their families.
Thank you for sharing. Thoughts are well taken. And, it's interesting, even in this new administration, the role for the church is becoming more and more critical because as we are going to survive all of this new administration's changes, the role of the community and the churches will become more and more important. So thank you for sharing. I think this will be the last article because it's 10:30 by my clock already. 10, yeah. So thank you for your comments. I did lose my wife yesterday, and thank you for your texts of
Mom, be
consolation.
seated.
Appreciate it very
Okay,
much.
okay. before he comes on.
So I look forward to seeing you all next week, and
Look up at him.
keep us in prayer. And hey, how you doing?
What's up, buddy?
Hey, how are you?
What you trying to do?
How you doing?
Okay.
Mom, what are you doing?
We can hear you. We can hear you.
Oh, okay, cool. How you all doing?
We're surviving
Good,
and thriving,
good.
and it's good to see you.
Mom was talking about that you all were saying. Well, Mom was telling me that you all were talking about peanut allergies, and to add a little bit to it, I had a reaction last week. I love Ruth Chris. What is it? The sweet potato casserole, and the sweet potato casserole comes with like a glaze of it's like a caramelization of some type of sugar, but yeah, brown sugar, and also pecans that are on top of the brown sugar. So I ordered one with the pecans and one without the pecans to go. Like 2 or 3 days later, I took my sweet potato casserole, the one without the pecans, to work, and warmed it up. And it was like 2 or 3 pieces of pecans in the sweet potato casserole, but I didn't know it until after I was eating it, and I felt something crunchy in my mouth, and I was like, "Oh, that ain't right." But I ate it anyway. Maybe I'm gonna say 3 to 5 minutes later, after ingesting the pecans, that's when I started to feel my throat getting scratchy. It's starting to close just a tad. And I mean, they weren't whole pecans. Of course, they were crunched up and stuff into pieces, but it was just that much that was starting to close my throat. So what I did was I just reached in my bag and make sure that my EpiPen was in there. And I just started to calm down, drink some water, and try to meditate a little bit. And it went away. It took probably maybe about a good 10 minutes after that to calm down now. But also, condolences to you and your family.
Well, you carry EpiPen with you
every day. I have to.
Yeah. So when you have EpiPen, you can take that chance.
Yeah.
If you don't,
Exactly.
you got to go to the emergency room.
Exactly.
Of course, he's the one who got peanut allergies from being in military.
Yeah,
it just seems weird. And as a mother, of course, first thing I said is, boy, you don't know what you're talking about, until I saw it for myself. So I don't know. I didn't get into it because we were talking about adolescents and peanut allergies. He's grown and got it. So I don't know, Darryl, if there are any statistics on adults getting peanut allergies. So
I'll look into it.
Yeah, I know you will.
Yeah, it was all nuts and seafood now. And growing up, I mean, it was fish every Friday. We used to tear it up, sit down and eat crabs with mom and dad. And now I can't be around it. I cannot be around it.
Okay, thank you for sharing. It's good to see you. I'm glad you're healthy and that you keep your EpiPen with you. So you're ready. You're ready.
Yes. All right, you all.
We all love you, Dr. Callender. We love you so much.
Yes, we love you.
Yeah, thank you very much.
Yes, we do. And we really appreciate your courage because, I feel like this is a family to me, it's, and it's important. I mean, we support you, anything that we can do for you in this difficult time. But, admire your courage we wanted to see you and we're glad we're having the group session today. But, please believe that we love you and would do anything for you.
All of us.
Pray.
Yeah.
Pray.
Mm-hmm.
God.
Thank you. Thank you very much.
You know what your son needs. And we are standing in intercession that you give it to him and give it to him good. Wrap your arms around him. Wipe his tears. Tell him you're there. And we love him. In Jesus' name, amen.
Thank you very much. I need it badly. See you next week.
Alrighty.
Yeah, Dr. Callender, we have a guest, iPad number 2. She's been on many times before. Give me your name again. iPad number 2.
Dolores Lumpkins.
All right, good to see you again. Come every Thursday, please.
Hi, Dolores. Thank you for joining us. Thank you.